Next, I'd like to ask Dr. Skhumbuzo Ngozwana to continue with the discussion. As I think Mabel has indicated, he has just such a lot of experience working in several countries in Africa as a consultant, now running his own company, which again has its sites all over the continent. Could you tell us, Doctor, what is your view about what is it that Africa needs to do to build its capacity in the pharmaceutical and healthcare sector? And how do you think the AfCFTA can contribute to this? Thank you.
Thank you, Faisal, and thank you for the invitation to participate in this important meeting. I think the first thing is really also to thank Dr. Okube. I had the privilege, obviously, of working on the Ethiopian strategy, and it's very pleasing to see the kind of work that's going on, for example, with the Kilinto Park that he mentioned, right? I think, you know, before we talk about the specifics of what the continent needs to do, I'd say, taking on to some softer issues, there's got to be a fundamental shift of the mind around local pharmaceutical production. There's been this long-standing cynical view that Africa cannot produce quality medicines, that Africa cannot compete with other people, and in fact that because we don't have the skills, we should not start. And to reach out answer, if we wait for the conditions to be perfect, we'll never start. I mean, we've just seen with COVID now how we are exposed, and we need to do something, and we need to do it urgently to reverse the situation. So how do we build this capability and this capacity? I think I would argue that there are probably 7 fundamental pillars that would assist us to build the capability to ensure that we're able to take care of our own, you know, needs in the future, and we assure or we ensure health security. The first pillar is regulatory strengthening and regulatory harmonization, right? If you don't have a strong regulatory system, you cannot build a sustainable pharmaceutical sector. You cannot put products on the market that protect public health. So we should start with the premise that, you know, although we are strong advocates of local production, we make it very clear that quality is sacred, it's sacrosanct, and we should never leave that behind. If you have very strong regulatory systems, they are able to work with your regulators, they are able to ensure that you put good products on the market and you protect public health. Of course, related to that is the whole area of regulatory harmonization that, you know, both Dr. Okube and in fact the previous speakers all spoke about. But the regulatory piece also, in order to be able to support and leverage on that and catalyze the development of local industry, it's also got to be used, and we have international experience from this, to catalyze the development of local industry. How do you do that? You need to have preferences or expedited reviews and approvals for products that are going to be locally produced. So there are a couple of other things that one can speak to about that. I think Sam mentioned reducing the cost of doing business, again, is another imperative for regulatory harmonization. Because right now, if you want to enter the ECOWAS market or the East African market or the SADC, you literally need to register in 14 or 15, whatever it is, markets. If you're a small local company, you do not have the deep pockets, you basically cannot take on, you know, producers from the East predominantly who have longer experience, you know, deeper pockets and all of that. The second pillar is really around procurement. It's high time that governments on the African continent utilize procurement as a financial asset for local companies. You need to come up with measures that, you know, you either cover side a portion of public procurement for local companies, you give price preferences, you do longer term tenders for local companies in order to assure manufacturers to give them certainty of both price and volume. And on the procurement front, again, as a continent, we need to be lobbying the international global public healthcare community to say, if you're going to fund programs on the continent, you need to cover aside a portion of what you fund for local companies. If you just go and do the sums and you look between 2009 and 2018, at least $7 billion was spent on medicines, anti-malaria, anti-TB, HIV drugs, and a couple of others across the continent. 98% of that, if not 99%, went outside of this continent. And the question we should be asking ourselves is, if we had invested at least 10% of that into local companies, where would we be? Would we have come to a situation where COVID hits and countries are within weeks of running out of paracetamol, of all the drugs? So the third pillar then that I move on to is around the incentives. The industry is a capital-intensive industry. If governments don't make the incentive packages available to support the industry, it's very difficult, especially when you have a lack of procurement support, to encourage the private sector to come in and invest in a very capital-intensive sector that would require probably 2-3 years before you commission a plant, before you get a return. I must say, if you look at Ethiopia, again, Dr. Okibe, I mean, the incentive package that the government has put in place is probably one of the best. And it's no wonder that companies like Humanwell and Sunshine and whatnot are putting up fantastic plants in Ethiopia, right? So the incentive piece is very important. There are also, I'll call them reverse incentives, which have worked very well. Things like restricted lists. If you look at Nigeria, for example, and Ghana, where they put together a number of products that could only be procured locally, and that was a catalyst with which then entrepreneurs came into the market, built plants, and were able to compete with certain products where they knew that they had the market all to themselves. That has grown the industries in both Nigeria and Kenya. We need to be looking at other policy instruments that also speak to the incentives, although indirectly, special economic zones, the pharmaceutical parks like Ilinto, where just by virtue of locating your plant there, you probably reduce the setup cost by 40-50%. You've got all these shared services that also reduce your operating costs. You've got FM Haka with an office there that allows you to register products quickly, do your variations quickly. So that's an important third pillar. The fourth pillar is around an area of policy instruments that, again, go towards supporting this industry. There are multiple barriers in various parts of the continent. For that matter, if you're a local company that's manufacturing, in some countries, the API that you bring in is hit with tariffs. The finished formulation that comes in, attracts absolutely no tariffs. So the policy instruments that we have need to be relooked, and they need to be tweaked in order to be able to support local production. The fifth pillar that we have is around developing the human capital that we need, obviously, to develop the sector. The sixth pillar is around the technology acquisition and assisting local companies to get, the technology and the products they need. And here we can bring to bear the research institutes to reverse engineer products and diffuse these technologies to our companies at a nominal cost. The last pillar is really around opening up markets, and that's where the Continental Free Trade Agreement comes in. And I'd argue that also has a couple of pillars. I've already spoken about some of them. The regulatory harmonization, the pooled, the regional pooled procurement, and I think Dr. Okibe spoke about the IGAP thing. We also need to be looking at policy coherence around the regions to enable the free movement of products. And I think lastly, if we want to talk about real health security, we need to be talking about API production. And I think that's something that can easily be done if we pull together as regions and do it collectively. Thank you.
Thank you so much, Dr. Ngozwana. Skhumbuzo, so perhaps if you can give us just a one-liner on the way forward as you see it based on the discussion we've had so far.
Yeah, look, I think we have seen with COVID that the position that we've taken as a continent has been deeply flawed, right? There is an African proverb that says only a fool builds a shield in the middle of a battle. And I think this is what we're exposed. We'd been warned before with the pandemic flu. We'd been warned before with the Chinese Olympics when we had shortages of ARVs. We'd been warned before with Cyclone Hardbat in Hyderabad, India, that damaged API plants, and we had shortages of ARVs. What COVID has shown us is that the capabilities here. We've had Nigeria, an institute there, and a student from one of the university built a ventilator from conception to final product 3 months. The same in Kenya, the same in South Africa. We've had local companies build PCR tests for COVID and a host of other things. We've seen companies like Pharmaceuticals who are leaders in the production of quinine API. The capability exists here. It's time the African leadership steps up and supports local companies, local expertise, and local capability. If we do not this, we will rule this, because COVID is not the first, it's not the last. And I'll close with an Amharic proverb that says, slowly, slowly, the egg will someday walk on its own 2 feet. We need to start, we'll start slowly, but at some point we'll start running. We need to start now, and I hope that the political leadership have learned a lesson from the COVID pandemic. Thank you.